A biopsy is the examination of any tissue that is obtained from an organ to determine the presence or the extent of the disease. Depending on the location of the diseased tissue, biopsies can be obtained under CT, ultrasound, or MRI guidance from outside the body. In certain conditions where structures are close to the gastrointestinal tract, an endoscopic ultrasound is a much better option because it is easier to perform and it safely obtains a higher quality of tissue. This is especially true for the pancreas, as well as masses and lymph nodes that are close to the esophagus, the stomach, and the small intestine. There are two types of tissue samples that can be obtained during an EUS guided needle biopsy: a fine needle aspiration, or FNA, which looks at diseased cells, and a fine needle biopsy, or an FNB, which looks at small pieces of tissue for a more detailed examination. If your physician has referred you for an endoscopic ultrasound with biopsy, it's likely due to one or a combination of the following: symptoms, abnormal blood tests, or an abnormality on an endoscopy, ultrasound, CAT scan, or MRI. If, for example, there is a suspected tumor in the pancreas, the physician performing the endoscopic ultrasound will be able to visualize and evaluate the pancreas, as well as its relation with the surrounding organs, blood vessels, and lymph nodes during the examination. A large portion of the liver can also be examined at this time and evaluated for any potential areas of concern. If one is seen, this can be biopsied at that time as well. Similarly, any surrounding lymph nodes can be evaluated and biopsied. It is important not only to define the nature of the pancreatic mass, but also to evaluate the adjacent lymph nodes, to evaluate the tumor's involvement with the adjacent organs, blood vessels, and to obtain tissue for diagnosis. Under endoscopic ultrasound guidance, the needle will be visualized passing through the stomach or the small intestinal wall into the region of concern within the pancreas. This is referred to as a fine needle aspiration, FNA, or a fine needle biopsy, FNB, depending on the type of needle used. The sample is then examined by a pathologist to confirm any abnormalities such as cancer. These results are often not finalized by the end of the procedure, but in some cases, a preliminary result can be discussed with your physician while in the recovery area. It may take up to 2 weeks for the lab to process the entire tissue sample. Your physician will let you know when to expect the results and if preliminary results are available. The timeline varies amongst facilities, so asking your physician how long it will take at your specific facility is recommended.